make up the smooth condyle where the elbow moves. Let's take a closer look here. The humerus of the upper bone is attached here to both the radius and the ulna. The medial epicondyle is the part of the bone that you can touch the most, which sticks out the most. Again, when you turn this around, you still have all the landmarks of the humerus, but you can see down below there is a trochlear fossa. That is where the actual base of the ulna inserts into, which creates the elbow. And here we go. A closer look shows the olecranon, which is a name given to the very end of the ulna. It looks like a hook or a bottle opener or a wrench. It inserts right into the olecranon fossa, which is a hole that grips it. You are basically looking at your elbow joint here. So the forearm consists of two long bones, the ulna and the radius. The radius is lateral. It is what inserts to the thumb joint area. The ulna connects to the pinky area. The olecranon is a name given to the elbow joint, basically. It's basically the elbow. And the rest of this is just landmarks, which you do not need to know for yet. What does the ulna articulate with? It articulates with the humerus. When the forearm is extended, it enters the fossa. But when the forearm is flexed, meaning the angle of your joint is decreased, then it enters the coronoid fossa. Here it is. As you see the two forearm bones, they are connected to the upper arm, and this is what it looks like when the bone is in a anatomical position. But when the bones crisscross, in other words, when your palms are not facing up and you twist your hand facing down, you do a movement called supination into pronation. That's when you're asking for hands out, maybe a handshake, but when you twist your hand inwards with the thumb facing medially, then that becomes a movement known as supination into pronation. This is the back, again, of the forearm. Look at the top. The trochlear notch is the part that helps to go into the actual olecranon, creating the elbow. The radius in the ulnar shaft is in the middle. And the most important thing to take from this picture, the interosseous membrane. That is a sheet of fibrocartilage and tendinous sheets that connects both bones at the wrist, or the entire forearm, should I say. The styloid process at the bottom of the radius is a part of the bone that you can actually palpate or feel in your wrist bone. Again, the interosseous membrane is the fibrous sheet that connects both the forearm bones together. The radius, again, is the lateral bone. It has some very important parts to it, such as the ulnar notch and the styloid process. Basically, remember that it stabilizes the wrist joint. A closer look at the end of the ulna shows that the olecranon actually looks like a wrench. It looks like the letter C at the top, and that's what allows you to dip into the elbow and cause motion or range of motion. Moving to the hand, you have 8 carpal bones in the wrist. They are considered short bones. There's 4 proximal, which means closest to the wrist. There are 4 distal carpal bones, which means farthest from the wrist. It allows your wrist to bend and twist, so you can shake hands and wave bye-bye. The 4 proximal bones in the carpal area includes number 1, the scaphoid, the lunate, triquetrum, and the pisiform. The 4 distal carpal bones include the trapezium, the trapezoid, capitate, and the hamate. Here is a picture of the hand in the anatomical position, anteriorly on the left and posteriorly on the right. Feel free to pause this video and study this where the landmarks of the 8 carpal bones are. Thank you and welcome back. Now, after you just studied the 8 parts of the carpal bones at the wrist, take note of the numbering of the metatarsals 1, 2, 3, 4, and 5. As you can see, all of these bones are numbered from lateral to medial in this position. It is important to know which ones are metatarsals. Metatarsals basically make the palm of your hand. And as you go down, you can see the 14 phalanges. There's only 2 bones in the thumb above the metacarpal, because the thumb really is the opposing finger, if you want to say, of all the digits in the hand. Whereas the other phalanges in your fingers, there's 3 actual bones. You have a distal, intermediate, and a proximal bone. The metacarpal bones are the 5 long bones of the hand, and this is how we number them from the thumb medially. They move and articulate with the proximal phalanges. And the phalanges, we said again, are the bones that make up your fingers. The thumb basically is known as the poly or pollex. Here again is another picture of the right hand anteriorly. Here's another picture of the right hand posteriorly. Now let's talk about the pelvic girdle. This is made up of the 2 hip bones. It's strongest to bear the body weight, stressing movement. This is a part of your pelvis. And the 3 major parts of the hip bone are the ilium, the ischium, and the pubis. Inside, you have the acetabulum, which is the hip socket. This, by the way, is where the femur inserts. It's the meeting point of all 3 sections of the bone, and it articulates with the femur, like I just said. Allows you to move and kick and swim and just basically walk. The acetabular notch is just a gap in the ridge of the margins of the acetabulum. It's just a landmark. Let's take a look at this. At the top is the ilium, or the iliac crest. That is the top where you put your hands on your hip when you're putting some kind of motion to the waist, where your belt line is. You actually sit on your ischial tuberosity. A lot of people think you sit on your coccyx, your tailbone. That's incorrect. The ischial tuberosity is the actual bone which protrudes from your gluteus maximus. When you sit on your hand and you move your rear, that's where you actually feel a bone sticking out. That's the ischial tuberosity. The third major part is the pubic symphysis, which is the anterior part of the internal meeting place of the pubis, usually behind the location of both male and female genitals. The ischial spine is located around the hip. The ischial tuberosity is what you sit on, as I said. The ramus meets the inferior part of the pubis, and the superior ramus meets the pubic tubercle. Basically, both ramuses are located in the projection joint. The pubic symphysis is a gap where the pubic tubercles meet, patterned with fibrocartilage. Now, this is the part during pregnancy when women do have a stretching of this ligament due to the childbearing procedures, and hence why women have larger hips than males. The obturator foramen is simply nothing but the opening where the muscles of the hip attach. Again, here's the picture of the hip. As you look at the smaller picture on top, you got the ilium.